Hello, and thank you for joining us for our annual Chronic Disease Day National Advocacy Livestream. My name is Claire Diwali, and I am the president of Good Days, a national nonprofit charitable organization that lifts the burdens of chronic illness through assistance, advocacy, and awareness. Chronic Disease Day is a time to raise awareness of the value and importance of federal programs that serve the chronic disease community. Each year, we use Chronic Disease Day to make your voice heard and address health challenges where we can make collective progress. I thank everyone who has joined our Stay Strong campaign and for actively advocating with policymakers to encourage additional annual support for federal public health and medical research activities. For our national advocacy livestream, we have perhaps the foremost experts on national public health policy, including Dr. Rochelle Walensky, Director of the Centers for Disease Control and Prevention, and one of the leading experts on medical research efforts, Dr. Doug Lowy, Director of the National Cancer Institute. But before we hear from Drs. Walensky and Lowy, I'm excited to discuss nationwide initiatives currently taking place to decrease rates of preventable chronic illness and broaden access to care with three of our nation's leading patient advocates. Please join me in welcoming Erica Sward, Assistant Vice President of the American Lung Association, Lorraine Steele, CEO of the American Liver Foundation, and John Robersher, CEO of the National Association of Chronic Disease Directors. So let's begin by having each one of you share more about your role at your respective organizations.
Good afternoon. It's my honor to be here. I'm Erica Sward, and I'm the National Assistant Vice President for Advocacy at the American Lung Association, where I oversee the policy and advocacy work for the Lung Association in the spaces of lung disease and lung health, tobacco control, and healthcare.
Good afternoon. I'm John Robersher. I'm Chief Executive Officer for the National Association of Chronic Disease Directors. We serve as the main recipients for funds to support state and territorial chronic disease prevention and health promotion.
And I'm Lorraine Steele, the Chief Executive Officer of the American Liver Foundation. I'm also a care partner for my husband, who's been living with a chronic disease for over 63 years. And I've seen firsthand the challenges of living with a chronic disease, the daily struggles, the roller coaster of the ups and downs. I understand how that affects the patient, the caregiver, and the family members. So I'm especially honored to join all of you here for this important discussion about chronic illness.
Well, thank you all again for joining us on this panel. So I'm going to just start with a few questions for each of you. So Lorraine, I'm going to start with you. What are the top chronic illness challenges that the American Liver Foundation helps to combat?
Sure, there are so many different types of liver diseases and conditions that the American Liver Foundation supports. The most common are hepatitis, viral hepatitis, non-alcoholic fatty liver disease. There are autoimmune diseases in liver, rare liver diseases, including genetic conditions, cancer, and many others. But I'd like to share with you today is most focused on fatty liver disease, which affects an estimated 80 to 100 million people in this country, yet many don't know it. Non-alcoholic fatty liver disease causes excess fat to build up in the liver. NAFLD is the most common cause of liver disease worldwide. The global prevalence of NAFLD is estimated as high as 1 billion people. And contrary to what many believe, it is not caused by heavy alcohol use. Research estimates that NAFLD is present in up to 75% of overweight people and almost 90% of people with severe obesity. NAFLD has become the most common form of childhood liver disease in the US, more than doubling over the past 20 years, partly because of the increase in childhood obesity. Studies estimate that 5 to 10% of children have NAFLD. A more severe form of NAFLD, NASH, is dangerously progressive and causes inflammation of the liver and liver damage, and it is expected to be the leading cause of liver transplantation in the US by 2025, only a few years away.
Yeah, I mean, I think that, the perfect reason for doing awareness programs like this is, I don't know, from an American standpoint, if we recognize all the different chronic illnesses, including cancers, that are related to obesity. So certainly thank you for your work there. Let's move over to Erica. Erica, what are the American Lung Association's priorities when it comes to creating healthier communities?
Well, the Lung Association is focused on a world free of lung disease, and really recognizing that that's a pretty big order there. We focus on our lung health and lung disease efforts, creating a tobacco-free future, ensuring that everyone has access to affordable, adequate, and accessible health care, and then, of course, championing clean or healthy air for everyone. The Lung Association is unique in many ways. We were created over 115 years ago, and we kind of have one foot in our public health roots and another foot in the patient advocacy space. But I think that that's really important because it gives us a 360-degree view into preventing and managing lung disease, which we do through our research, education, and advocacy efforts. And so I might walk you through an example about how we might serve a child with asthma, to kind of give you a good example of our breadth. The national level, we might fund a research or partner with a researcher to come up with a new way to look at a disease or treatment. We advocate for their health care so they can get better medications and see the specialists they need to manage their disease. We advocate for funding for NIH for better research and treatments and guidelines, for CDC's National Asthma Control Program, so there are evidence-based practices that can be carried out, including data and surveillance at CDC, and for clean air standards to ensure that the air they breathe is safe and healthy. At the state level, we've advocated for this child's state to be smoke-free, for the state to have an asthma program and require schools to stock albuterol for emergencies if the child has an asthma episode unexpectedly at school. At the community level, the child's school may partner with us to use our Open Airways for Schools programs, and if their parents smoke, they might enroll in one of our Freedom from Smoking programs or call our lung helpline at 1-800-LUNG-USA. And if this child is still having problems or going into the emergency department or missing school, we may work with them or another community partner to go into their homes to determine triggers and make their homes safe for them to breathe. So really top to bottom, we recognize how important it is for all of us to live in a place where we often say when you can't breathe, nothing else matters. And so the only other point that I would say is that we recognize that lung disease does discriminate. And much of our work is really focused on eliminating health disparities and promoting health equity across all of our big buckets of focus.
Well, thank you so much for that and for all that you all are doing. I'm going to move it over to John. So in relation to that, how does the National Association of Chronic Disease Directors collaborate with each state to promote chronic disease prevention?
Thank you for the question, and thanks for letting us be on the panel. So NACDD, the National Association of Chronic Disease Directors, our central role and challenge is really leading and supporting states and territorial chronic disease programs. We represent over 7,000 members who work in governmental public health across the United States. We provide educational and professional development opportunities, technical assistance, and virtual and in-person venues to connect with other chronic disease professionals across the country. Our big, I think at one point you asked, what are our big legislative priorities? And one of the things, and I love the comment obesity is a common risk factor for every chronic condition.
Yes.
And we are working towards the prevention of diabetes, heart disease and stroke, cancer. We try to reduce the early onset of arthritis and work on many other chronic diseases. But the risk factors are really important because risk factors are changeable. We, in our lives, can make choices, better choices around increasing our physical activity, increasing our intake of nutritious foods, decreasing tobacco, and decreasing alcohol. And I think that if we could sort of stick to those four things in the United States, we could live healthier lives and either delay or just eradicate coming in connection with many chronic conditions.
Which also leads into, what our children are doing. They're seeing how we live, what we eat, and our daily activities, and it is kind of, we're perpetuating a problem in which it's under our control, which is probably one of the most concerning things about these chronic illnesses. So Lorraine, I'm going to ask, so earlier this year you launched the Think Liver, Think Life, and it's a nationwide screening and public awareness campaign. Can you tell us what the goals of the campaign are and what you want to achieve with them?
Absolutely. Think Liver, Think Life aims to help prevent and detect liver disease earlier. It affects better management and treatment of liver disease, reduce the stigma associated with liver disease, address the health inequalities, and advance changes in federal policy and increase funding for research. The campaign launches in 10 states later this summer with diagnostic testing, including liver panels and assessments to help identify fatty liver disease and liver cancer. And it also includes a public awareness campaign, patient and provider education, and a resource and information center, all kicking off this fall. And a team of our ALF's health specialists and will partner with local community health centers and state departments of health to screen those most at risk for fatty liver disease and provide a connection to follow-up care where appropriate. The really good news is getting a diagnosis early is critical because it gives patients a chance to reverse course before liver disease progresses.
So just to add on that, we hear a lot about getting like breast cancer screening, colorectal, or, colonoscopies regularly. But you don't hear a lot about, getting these types of checks. So when do you know you need to do that? Is there an age?
It's interesting. We were talking about pediatrics. We were told by the top pediatric hepatologists and gastroenterologists they're actually seeing fatty liver disease in utero and at age 1 or 2. It is tragic what childhood obesity is doing. So we'll be testing children at a young age. But if you have type 2 diabetes, if you have a high BMI or obesity, if you are in the Hispanic and Asian communities, you probably really want to be screened for fatty liver. And it's a simple blood test. And hopefully we can catch it early and we can direct people to the tools and resources they need. Nutrition counseling, exercise support, and general health and wellness.
That would not only help them with that, but with, just their path through life. Whether it's a chronic illness, stress, I think a lot of that has to do with, or even the way you'd overcome it is by diet and exercise. So thank you so much for that. So Erica, I'm going to move over to you. So how does your organization engage with Congress and the White House to help prevent the occurrence of chronic illness?
Well, the Lung Association really recognizes how important it is for not only all of us to be talking and communicating with our elected officials in Washington, both directly, but then also to really make sure that we're educating members and the administration about whether it be evidence-based programs. But I want to talk for a moment about the importance of investments, because the Lung Association really spends and recognizes that our nation puts its priorities really based on funding and appropriations bills. And so we work very hard throughout the federal appropriations process to make sure that we're empowering our volunteers to share their voices about how important increasing investments at the Centers for Disease Control and Prevention and at the National Institutes of Health are, just to name two. And then really to make sure that we see how everything goes together from the public health continuum. If we only invest in one or two of our nation's public health agencies, like an NIH or a CDC, and we're neglecting the other parts of the process, whether it be at the Indian Health Service or at SAMHSA on mental health, we're really not investing in the whole person. And because lung disease cuts across so many different spaces, and of course anyone who has lungs is susceptible to having challenges breathing if it's poor air quality day, or if they of course have a lung disease. We want to make sure that we're making these investments not just at NIH or CDC, but we're also looking at the DoD and EPA and other places. And so what we work very hard with patient community to do is to make sure they know how to communicate with their members of Congress. We certainly involve our leadership, both our volunteer and staff leadership, that we have our state advocacy directors from across the country communicating up with their members of Congress directly. And so I think we work hard to do some really key media advocacy and education reports to call attention to the challenges and the needs for cleaner air, whether it's our State of the Air report, which is released every April, or our State of Tobacco Control report that's released every January. And so all of these tools come together to allow us to form better relationships with decision makers and to make sure that we are speaking up for every person in our country who has one or two lungs.
Absolutely. And so, John, this leads me over to you. So what national advocacy initiatives are at the top of your agenda?
Yeah, thank you. So our main focus for advocacy is to support at CDC, the National Center for Chronic Disease Prevention Health Promotion. That virtually cuts across all chronic diseases and conditions and risk factors. And that's where we focus, our support and try to get members of Congress to agree. We need to spend a lot more money on prevention than we do. It's poor in that we think so little of prevention, and yet we spend so much money on the medical side of treatment. And if we could prevent more, I guarantee you we'd spend less on the treatment side on the other end. Many people may not know that, number one risk factors for everything we've talked about on this panel is if we can increase physical activity and nutrition across the country. And you may not know it, but there is not a program, a state program in every state. And so you may be looking for resources of how can I create opportunities in my community, in my neighborhood for physical activity, or building a sidewalk, or building green space, or developing a food bank, or trying to provide more nutritious meals for children. And there may not be a program. And we really need to that's our number one priority, is to get more resources to the Division of Nutrition, Physical Activity, and Obesity. And that is the program at CDC out of the National Center that's focused on risk factors, including physical activity and nutrition. And so that's where really we spend a lot of our energy in trying to educate policymakers about that center. And about the other 11 or 12 centers at the National Center, and really making sure that there are opportunities for prevention in every state, in every community, to give people the support they need to be healthier.
And I certainly believe that that starts at home. And so, one of the reasons, or I mean, the sole reason behind, Chronic Disease Day and the awareness of it, 7 out of the top 10 deaths are related to chronic disease. Again, the most staggering part is the majority of those are preventable. And, the 90% of our healthcare spend is on preventable chronic illness. And so, there's a lot that we can do as a country, as a community, to try to fix that, to try to, change those numbers. And, one of the other things, healthy eating and diet and exercise isn't just for diseases that are preventable. It's for those that are genetic. I have ulcerative colitis, and I found that when I eat better and I exercise, I have better outcomes. So in general, healthy eating and a more active lifestyle is just conducive to even better mental health, better breathing. So, thank you guys all for everything that you're doing to contribute to that. So I have a last question that I would like y'all to think upon and see how we can work together as a nation to help support you. So, what can we do and our listeners do to help support all the causes and the different mechanisms of action that you all are trying to take to create positive outcomes? Why don't we start with John?
Well, I would just first say, everyone, thank you for everything you are doing and for being interested enough to participate on this call today. We really need to get focused on preventable chronic disease conditions and activate your, talk to your congressman and even at the state level, talk to your folks in state government, because state governments fund a lot of prevention programs, and make sure that they understand how important and necessary it is for us to live fully healthy and productive lives. And we could go on all afternoon. The four of us talk so much about absenteeism and presenteeism. People, if you don't feel well, you're not going to perform well at work, et cetera. So there's many, many opportunities for us to just live a much healthier, more vibrant life, but we can't do that when we're suffering from chronic conditions.
Erica, what are your thoughts for yours?
Well, I think we really must recognize that if we try to only deal with one issue, that really improving and getting to healthier communities cuts across all of our issues. And I think that's one of the reasons that the Lung Association is in partners with so many other groups to increase funding overall for CDC and other public health agencies, recognizing that we need to do better when it comes to investing in public health, and we recognize that so many lung diseases are preventable, and if not preventable, at least manageable, particularly those that are caused by tobacco use, which remains the leading cause of preventable death in the United States. So I think it's important for all of us, whether that we are advocates, whether we are health practitioners, whether we are media, that we are still communicating about the importance of preventing disease, and how that really will lead to a healthier and happier nation.
Perfect. And Lorraine?
I echo all that was just shared so eloquently. And, the American Liver Foundation, we're here for you. The Resource Center and our microsite for the Think Liver, Think Life campaign you heard me discuss will be live very soon. Look for it. We'll also have information on where you can find a free screening near you. You'll find more information on our website, liverfoundation.org. Also, we would love to have you volunteer with us. We need you. There's a big problem here in this country with liver disease. 100 million people or more affected. So please, again, go to liverfoundation.org. There's a section called How You Can Help. You can become an advocate and meet with the lawmakers, tell your story, get involved with one of our many activities, and we're here for you.
Well, thank you all so much. And, I certainly agree. You can't conquer something alone, but when you have such great organizations like y'all's coming together, I think we can really make a difference. And, I think it's an appropriate time now. I don't think that it's ever been taught. I am Native American and also Hispanic. So, I've got type 2 diabetes, obesity surrounding me. And I think that the biggest misconception is, well, it's in my genetic profile. Well, it isn't. You can do things to change that. One of the things that I've learned the most over the last probably 15 years, which I never realized, and I don't know how much of our listeners would even know, or in America in general, is that there are many types of diseases, including cancer, that are related to obesity. So it's not something that happens to us. It's something that we're doing to ourselves in many of these cases. So I think, the more awareness that we can bring to that, and more education, and more opportunity to take small steps to make change, I think it's going to be great for this country. So thank you all again for sharing your time and expertise. I appreciate you guys.
Thank you.
Thank you.
Mhm. So next up, I'm very excited to welcome special remarks from Dr. Rochelle Walensky, Director of the CDC, immediately followed by Dr. Douglas Lowy, Director of the National Cancer Institute. Dr. Walensky is a national expert on public health and has taken leadership of an increasingly dynamic and innovative Centers of Disease Control and Prevention. Beyond the comprehensive response to COVID-19 and other infectious diseases, the CDC is implementing new programming across its centers, including efforts to address health disparities and promote health equity. We're honored to also have Dr. Doug Lowy, the acting director of the National Cancer Institute, with us today. Now that President Biden has reinvigorated the Cancer Moonshot Initiative, Dr. Lowy has a timely update for the community on recent progress and emerging activities. Let's tune in.
Public health's job, CDC's job, is to bring people together to talk about what impacts health, to share our data and expertise, and to support change at the individual and population levels so that we can create the conditions in which people can live healthier lives. We are grateful to have you as partners as we make sure we are better prepared for the future, with health equity informing everything we do. Thank you for the work you do, raising awareness about ways we can build healthier communities across the country. It's an understatement to say that the past 2.5 years have been challenging. There were incredibly hard moments, way too many of them. But the silver lining in these tragic times is that these moments opened our eyes, broadened our networks, and brought us closer in our commitment to help people and communities prevent chronic diseases and promote health and wellness for all. The pandemic underscored the need for prevention, not just infectious disease prevention, but chronic disease prevention. And for those with chronic disease, COVID has had a profound impact. 41% of U.S. adults reported avoiding medical care due to concerns related to COVID, including 32% of adults who avoided routine care. Not only did people not see their doctors, they did not go to the pharmacy to get prescriptions refilled. They lost their jobs and health insurance. They lost loved ones and sometimes their faith. We saw steep decreases in breast, colon, and cervical cancer screening, all of which decreased by more than 85% compared to 5-year prior averages. We saw delays and gaps in screening and management of diabetes and of hypertension, which affects more than 116 million adults in the United States. With the reductions in mobility, increased food shortages, and declining mental health during the pandemic, we saw a shift away from healthy behaviors and an increase in several of the leading risk behaviors for chronic disease, including poor nutrition, lack of physical activity, and excessive alcohol use. Choices such as these can lead to increases in obesity, especially in children from 2 to 18 years old, where the rate nearly doubled during the pandemic. And given the close relationship of obesity to diabetes, we expect to see increased rates of type 2 diabetes as well. COVID had us working to answer new questions about the consequences of COVID for individuals with existing chronic disease and for people who had never had chronic disease before, but who now will have chronic conditions because of COVID. We're especially concerned about respiratory disease, heart disease, kidney disease, obesity, and diabetes, and the impact post-COVID conditions, sometimes referred to as long COVID, could have on these diseases. Our task coming out of this pandemic is to understand the damage that has been done, to document it, and to use our resources effectively to address it, as we lean into our creativity to make real progress. Aside from the effects of COVID, we have long known that tobacco use, poor nutrition, physical inactivity, and excessive alcohol use are often the result of where we live and work, our education, our physical and mental abilities, and our income. And these structural factors often are based on race and ethnicity. When I became CDC director, I came as a practicing physician treating patients who had to make the impossible choice of filling a prescription or going without food on their plates. I witnessed firsthand the impact of health inequities on individuals and families with little or no access to care. It was important to me to bring my passion and advocacy for health equity to my role as director of the agency charged with protecting the health of all people in our country. In April, 10 weeks after becoming CDC director, I joined voices from across the country and declared racism a serious public health threat that directly affects the well-being of millions of Americans and, as a result, affects the health of our entire nation. Of course, CDC has long recognized that racism is the root cause of many health disparities. However, that April declaration made it clear that we were recommitting ourselves to the work of addressing the challenges driven by structural factors, by racism and discrimination, and by historical disenfranchisement that deeply impact the communities we live in, especially communities of color, and people with disabilities, members of the LGBTQ community, women, individuals who are incarcerated without homes, and those who live in rural or frontier settings. We know structural factors have lifelong and often negative consequences on the mental and physical health of those affected. We cannot let our country's complicated racial history follow us into the future. We need to understand the roots of health inequities so we can reduce barriers and build a more inclusive health system. Recognizing racism as a public health threat has given incredible momentum to thinking about how inequities affect disease. CDC's National Center for Chronic Disease Prevention and Health Promotion, NCCDPHP, is focusing on the social determinants we believe are strongly tied to chronic disease: social connectedness, community clinical linkages, tobacco-free policies, and the built environment, including housing and transportation. We're also looking at food and nutrition security. By using this equity framework, we're better able to acknowledge and address unfair, avoidable, and solvable differences in opportunities for health that systematically disadvantage people. If we expect health systems, communities, and public health to pull together and address social determinants of health, there's also tremendous need to have the data to understand the extent of chronic diseases and the policies, systems, and behaviors that are leading to them. Over a year ago, NCCDPHP launched a new web application called Places. It includes 29 self-reported behaviors that come out of the Behavioral Risk Factor Surveillance System and provides information on both the chronic disease and the behaviors across all communities in the United States, including data for smaller cities and rural areas. Planned enhancements to Places include incorporating community indicators around social determinants of health. And last year, NCCDPHP launched its first social determinant of health pilot program to help accelerate actions among 20 state, local, tribal, and territorial jurisdictions that will prevent and reduce chronic diseases among people experiencing health disparities. This fall, there will be 40 additional jurisdictions added to this program. NCCDPHP recently announced $215 million in fiscal year 2022 appropriated funds to continue funding 3 of CDC's national programs to prevent and control cancer. This funding will help provide breast and cervical cancer screening to vulnerable women with little or no access to care, to implement comprehensive cancer control strategies that can reduce preventable cancers, and collect and report cancer data critical to shaping our efforts. This critical funding builds on investments CDC has made in a comprehensive, coordinated cancer prevention and control portfolio for more than 30 years. In addition, our national and state tobacco control program continues its work to reduce tobacco-related diseases and deaths. The program is the only nationwide investment that supports all 50 states, the District of Columbia, 8 U.S. territories, and 26 tribal organizations to protect children and help smokers quit. Similarly, NCCDPHP's Racial and Ethnic Approaches to Community Health program, known as REACH, also focuses on tobacco use, alongside other risk factors such as nutrition and physical activity. It's one of the only CDC programs focused on reducing high rates of chronic disease for specific racial and ethnic groups in urban, rural, and tribal communities. REACH uses a community-based participatory approach through which program recipients partner with local communities to identify their unique needs, their assets, and opportunities. Through REACH, more than 2.9 million people have better access to healthy foods and beverages. More than 322,000 people have benefited from smoke-free and tobacco-free interventions, and approximately 1.4 million people have more opportunities to be physically active. Our alcohol program works to prevent excessive alcohol use by collecting and sharing data to guide prevention strategies. We support alcohol epidemiologists in 9 states in conducting public health surveillance on excessive alcohol use and guiding state and community efforts to prevent this behavior. The pandemic showed us the power of telemedicine, a promising development in the world of prevention. As we move forward, we must remember to understand the limitations of virtual care so we do not create more inequities. We know some people were able to access telehealth while others could not. Access was often dependent on people's individual practices, whether they had the technology, and whether they could use the technology even if it was available. As we think about expanding access to telemedicine and the technologies that support it, including broadband, we're also expanding our public health workforce to strengthen disease prevention. A CDC program will award $348 million over a 3-year period to support COVID-19 prevention and control by community health workers, those frontline public health workers who have a trusted relationship with the community and are able to facilitate access to a variety of services and resources for community members. Our investment in community health workers is about more than COVID-19. It's about establishing an infrastructure for equitable public health in the future and making sure that our public health workforce is effectively trained and reflects the communities and diversity of the communities they serve. Our resources can support existing efforts, catalyze others, and hopefully make a difference in how we address prevention going forward. We're truly all in this together. I know you will keep the conversation going by fostering sustainable multi-sector partnerships, by catalyzing action across disciplines, and most importantly, by ensuring the voices of the communities we serve are included in planning and decision-making every step of the way. We are transforming a nation that we all love, thanks to the dedication of all of you.
Hello, I'm Dr. Douglas Lowy, the Acting Director of the National Cancer Institute, which is part of the National Institutes of Health. I would like to thank the patient advocates who are participating across the country in Chronic Disease Day. We need passionate people like you to help us end this devastating disease as well as many other diseases. I'm going to talk with you today about cancer, which is the area where we do research. Over the last few years, we have made substantial progress in the prevention, diagnosis, and treatment of cancer, with substantial decreases in mortality rates. But those advances have really not been uniform. And we need to recognize, first, that more than 600,000 people die from cancer every year in the United States. And second, that there are several cancer types, for example, pancreatic cancer and many rare cancers, where we have not made much progress. So a very important aspect going forward is not just to make progress against cancer in general, but specifically against those cancers where progress up to now has been limited. In this regard, the cancer moonshot has really been a shot in the arm for the NCI in terms of research that we have been conducting over the last few years. And the announcement of the Biden administration of the new supercharged moonshot promises to be able to deliver even more. There are several key aspects to the cancer moonshot as articulated by the Biden administration. One is to decrease by at least 50% the mortality rate compared to today and to do it over the next 25 years. A second is to end cancer as we know it. And the third is for there to be equitable opportunities for people to get the appropriate first-rate delivery of care for prevention, screening, and treatment of cancer. In order to do this, it will be necessary but not sufficient for us to decrease the mortality rate from cancer by at least 50%. I believe that this is an achievable goal over the next 25 years. But that goal by itself will not be enough if we don't end cancer as we know it. And ending cancer as we know it means to make progress against those cancers where we have up to now had very limited progress. As I mentioned, for example, pancreatic cancer and rare cancers. We need to make progress in those areas if we are going to achieve the vision of ending cancer as we know it. In addition, we need to redouble our efforts so that all people in the United States have access to first-rate care, not just for cancer, but for all diseases. The way that we envision at the National Cancer Institute to be able to participate actively in achieving the aspirational vision of the Biden administration is a multi-pronged effort. It includes, for example, increasing our pipeline of drugs. And I'm talking about drugs not just for the treatment of cancer, but also for the prevention of cancer, the so-called interception of cancer, and developing new approaches for cancer screening. In order to take this increased pipeline with its great opportunities forward, we need to increase the availability of clinical trials. And clinical trials are what are needed in order to take the discoveries that are made that we think may be able to help patients and to develop the critical evidence needed to show that these interventions actually work as designed and they can benefit patients. Once we have done that, it then is necessary to be able to do so-called implementation research, because it's one thing to know that something works. It's something else for it to be brought forward for the general community. And by working with communities and doing implementation research of various kinds, we will be able to take the new standards of care and implement them rapidly and widely, as well as taking current standards of care and make sure that they are widely disseminated in an equitable and appropriate manner. Finally, it becomes critical for us to change the cancer workforce, particularly the people who are delivering cancer care and cancer research, so that they are more reflective of the wide diversity of people in the population. With this multi-pronged effort, plus many additional downstream efforts in addition to the research for providing optimal healthcare delivery, the all of government approach envisioned by the Biden administration has tremendous opportunities for making progress against this terrible disease. Our patients are counting on it, and we must deliver. Thank you very much for your attention, and thank you for your participation and your advocacy on this important issue.
Thank you again to Dr. Walensky and Dr. Lowy. We are so thankful for your hard work. In part, as a result of community advocacy, Congress sought to increase funding for NIH, CDC, and the National Center for Chronic Disease Prevention and Health Promotion this year. But much more needs to be done. As policymakers work on appropriations for next year, I encourage grassroots efforts I encourage grassroots advocates and the leaders of national organizations to join our efforts to educate legislators about the importance of programs that serve the chronic disease community. Thank you again for joining us today. And for more information on how you can support Chronic Disease Day, please visit chronicdiseaseday.org. Thank you all and have a great day.